Let's talk about the middle-aged or senior pet. What is a middle-aged or senior pet? Well, it really depends on the breed and the size of the dog. For example, a Great Dane, senior Great Dane is considered at 5 years of age, whereas a Chihuahua it might be, 9 or 10. So that's kind of a term that's kind of general. But let's talk about some health issues that we see in middle-aged and senior pets that will help you with your pet health issues. Let's talk about dental disease. 80% of all dogs and cats over the age of 4 or 5 have some degree of periodontal disease. What is periodontal disease? That's an infection of the gums. And how do you know if they have periodontal disease? Bad breath, sometimes they have trouble chewing, you'll see plaque and tartar build up, and there's a lot of things you can do at home to prevent or at least help the health of your gums and your pet's gums. One is brushing. Unfortunately, most people won't brush their dog's teeth, and I understand that. So we have other things. We have sprays you can put in. We have creams that you can put in the mouth, and it helps. Ask us about that, and we'll go over all the different things that we can recommend to keep your dog or cat's gums healthier. We recommend cleaning professionally your dog or cat's teeth every year, year and a half, once they get to be the age of 3 or 4 or 5 years of age, depending on the patient. And this is a procedure that we have to actually sedate the dog or cat, and we use an ultrasound dental scaler. We hand scale them, we curate the gums, we polish the teeth, we give them a fluoride treatment, and then we do gum surgery if they need it. But the more often you have prophylactic dental scalings and cleanings, the less you'll have to worry about periodontal procedures in your pet. So keep in mind that dentistry is one of the best ways that you can keep your pet healthy. So ask us about that. The next thing I want to discuss briefly is arthritis. As pets get older, they develop arthritis. Large breeds start showing signs of arthritis at 3, 4, 5 years of age sometimes. But all dogs, whether it's a Chihuahua or a Great Dane, are going to become arthritic just at different stages. We have some wonderful all-natural medications that we can use. We have a lot of non-steroidal anti-inflammatory medications that we use very successfully. So we have a lot of things we can do to help your pet with arthritis. How do you know your pet has arthritis? Well, you'll start seeing them get up a little bit slower, get down a little bit slower. You'll start seeing them not want to jump like they used to, maybe limping every now and then. Sometimes we have to take x-rays to diagnose it, but all pets are going to develop arthritis if they live long enough. Digestive problems. As pets get older, sometimes they had some food intolerance issues. They can't tolerate certain things, and we have special diets sometimes for this. But it's not a good idea to feed middle-aged or older dogs a lot of spicy foods and fatty foods. Middle-aged and older dogs sometimes show behavioral changes. For example, they may sleep more or less. Bladder control is an issue sometimes as they get older. They lose their hearing, they lose their vision, they develop dementia. These are all things that happen if they live long enough. For example, dogs, when they get to be 7 or 8, 9 years of age, start losing somewhere around 5 to 10% of their hearing every year after that. But that's normal. There's a lot of things we can do to help this. You just need to ask us about these issues as you see them presented to you in their home environment. Let's talk about some metabolic changes, some metabolic diseases that occur in middle-aged and senior pets. One is obesity or weight issues. That's a real big problem because as a pet gets older, the metabolic rate decreases, so if they eat the same amount of calories, they put on weight. So weight issues are very, very important. We see a lot of heart problems and diabetes mostly in overweight pets, just like in people. We see more diabetes now in dogs and cats than we ever did. We don't know why, but we do. We see a lot of thyroid problems, particularly in cats. We see a lot of thyroid problems in cats that have to do with the little thyroid tumors. It's very common in older cats. It's called hyperthyroid. In dogs, it's the opposite. We usually see low thyroid function, called hypothyroid. But it causes different things in the dog and the cat. Let's talk about cancer. 25% of all pets develop cancer. First, you may notice just a lump, but don't take that lump for granted. Get it checked. Many times they're nothing but fatty tumors, benign skin tumors, and it's nothing to worry about. But we can do a needle aspirate, we can do biopsies, and we can determine whether or not it's something serious. But don't take any lump for granted. And the incidence of cancer increases with age, but the earlier we diagnose it, the more we can do about it. So cancer is prevalent in pets just like it is in people, but early diagnosis makes a big difference. Let's talk about exercise. Exercise is good for you and I, and exercise is good for your pets. Play with your pet, throw a ball, take them for walks. As they get older, moderate exercise, just walking them around the block a time or two, makes a world of difference to them as well as to you. And then let's talk about just regular checkup exams and regular lab work and diagnostics that we recommend for the senior pet or the middle-aged pet. After your pet gets to be 6, 7, 8 years of age, it's a good idea to have them checked every 6 months. Get a good exam every 6 months. The reason for that, that's like you going and getting an exam every 3 to 4 years because they age so much quicker than we do. And then we will recommend regular blood work, blood chemistries, to determine if there's any early signs of diseases that we can pick up on a blood picture without picking it up on an exam. So if we use an exam and a blood work analysis, then we can usually pick up a lot of diseases earlier. And the earlier we pick up diseases, the more treatable they are. It's our goal to recommend the best medical care for your pet because we know that when we make your pet live longer and healthier, that means you'll be a happier pet owner, and that's our goal.